the effect of work-related pain in manual therapists, and the impact of occupational therapy interventions. A poster presentation by
Danielle Bessette,
Kacey Gifford,
Samantha Jerry,
and Carol Tinio.
This is our full completed poster. Some background information. Manual therapy requires forceful exertions and resistance, awkward wrist angles, mechanical stress to joints, and the use of pinch grip spans in different ranges. Health professionals that utilize manual therapy consist of occupational therapists, physical therapists, and certified hand therapists. Research and studies in this area are new and minimal, even though studies that have been conducted show a prevalence rate of work-related injuries in manual therapists that are seen in heavy manufacturing. Some prevalence rates. 95% of therapists are working while injured. 75% of therapists have altered their work habits due to pain. 54% of work-related injuries are due to manual therapy and transfers and lifts. 30% of therapists have changed jobs due to musculoskeletal injuries.
Problem and purpose. Manual therapists are considered an at-risk population for work-related pain and injuries, primarily due to their environment and their hands-on treatment approach. The objective of this study is to learn about the cause and effect of work-related pain and injury in therapists who use manual techniques in order to help determine how occupational therapy services can prevent them from occurring. Our questions are, how does work-related pain and injury impact manual therapists? And is there a need for occupational therapy intervention? Methods. Our study design is a qualitative phenomenological research design, and we ensured for validity and reliability through piloting our survey. Our population is outpatient manual therapists, including occupational therapists, occupational therapy assistants, physical therapists, physical therapy assistants, certified hand therapists, and chiropractors. And our sampling method is a convenience and snowball sampling method with 41 total participants. The exclusion criteria is not licensed in a therapeutic discipline, including physical therapist, occupational therapist, certified hand therapist, or chiropractor, and not currently practicing in their respective discipline. Our data collection is a 19-item survey, and we included digital copies accessible to participants via Google Forms link and ordinal data analysis via Google Forms and thematic coding.
there were a total of 48 responses to the survey. However, 7 were removed due to not meeting inclusion criteria, therefore leaving a sample of 41 participants. 87% of participants experienced pain as a result of their job duties within the past year. 85% of participants have performed self-treatments for their pain. 80% of therapists have modified their work techniques as a result of pain. Over 50% of therapists are working more than 40 hours a week, with 34% practicing for more than 21 years as a therapist and 31% practicing less than 5 years as a therapist. Common themes within this study included the common location and intensity of pain experienced by therapists being a 4 out of 10 in the wrist, hands, thumbs, and fingers. Common self-treatments including taping, use of orthoses, and use of physical agent modalities, commonly ice, heat, ultrasound, and paraffin. 32% of participants reported that social participation and participation in instrumental activities of daily living have been impacted by work-related pain over the last month. Specifically, home management tasks, including cooking and meal preparation, and lawn, garden, and yard maintenance were most affected. And lastly, commonly treated injuries that therapists treat include joint pain and injuries in the wrist and shoulders.
There were a lot of takeaways from this research study, some of them being that there was an extremely high prevalence rate of work-related pain. Therapists are working while in pain and/or injured, that there's a large presence of cumulative trauma in this population, and that manual therapists tend to self-treat their pain through use of taping, splinting, physical agent modalities, and stretching. Work techniques are also being modified due to pain, primarily via modified upper extremity placement, environmental modifications, and changing ergonomic techniques. Pain was prevalent across all professions, ages, genders, and years of clinical experience. Pain impacted instrumental activities of daily living, including home management tasks and social and leisure activities. Mental and physical burnout is also pushing therapists to leave this setting. The conclusion. This study revealed that the prevalence of work-related injuries and pain is high among several types of manual therapists due to the demands of this profession. Work-related injuries and pain have a negative impact on areas including occupational function, job performance, physical limitations, and quality of life. The study outcomes and principles also apply to other manual therapy providers in other settings other than outpatient therapy, as the ergonomic principles mentioned in this study also apply to settings such as pediatrics, geriatrics, and others. The results of this study indicate a great need for occupational therapy intervention and education within this population. This may include, but is not limited to, evidence-based practice, activity modification, ergonomics, and the use of tools and medication. With that being said, we were now going to move into our scholarly components, which touch upon some occupational therapy interventions.
Demographics and other factors contributing to work-related pain and injury. Factors include individual factors such as years of experience, age, gender, physical factors, environmental factors, and use of proper ergonomics and positioning. With regards to years of experience, the results portray that manual therapists experience pain in a variety of years of experience, from less than 5 years to over 21 years of experience. With regard to hours worked per week, a majority of therapists are working over 40 hours per week, which may contribute to the prevalence of pain. 85% of therapists are performing self-treatments for pain, including manual techniques, medications, and other methods which may alleviate their pain.
Impact of body mechanics, posture, and the work environment on work-related pain and injury. The following pictures on the left side of your screen show the ergonomic interventions that were provided to a manual therapist. On the top left is a long gel keyboard pad for documentation. On that same picture is a small gel pad used for documentation as well as for the elbow during treatment during massage. The middle picture in the top shows the back strap posture corrector. And the bottom two pictures show a handmade laptop sleeve made of neoprene material by the student researcher. On the right side of the page, you will see the feedback from the therapist who trialed these interventions. Initially, she thought the top left picture, both interventions in the top left picture were good. However, over time, it got to be cumbersome. The therapist's favorite intervention was the handmade laptop sleeve by the student researcher.
The implications of tools and client-centered interventions to address work-related pain and injury. For my scholarly component, I worked in collaboration with other student researcher, Kacey Gifford, to select tools that were selected based off of the responses of the needs assessment. The tools that I studied were back and hook neck massager, finger joint protector, and CMC joint protector. The back and neck hook massager was also trialed by the therapist that was previously mentioned. This tool could be used specifically on the therapist and as reported by the needs assessment and as well through research. Upper extremity pain is common with this profession. The back and neck hook massager was a great hit with her, and she reported that it was easy to use, it gets the spots, and it's lightweight. The finger joint protector, however, had a different set of feedback. She reported that it was awkward and it limited her ability to get sensory feedback from her clients. The CMC joint protector had a nice ergonomic position and was good for trigger points in the forearm. It had a hefty design and it's not fragile under the pressure applied, and it's okay at the elbow and better for shoulder and upper back. Based off of her feedback, I decided to tailor my client-centered interventions to not only addressing reported thumb pain, but also working on having an intervention that still allows for sensory feedback. Through collaborative efforts with the participant, we came up with using kinesio taping to support the CMC and MP joints, as well as trial 2 different types of splints.
So I focused on the utilization of tools to prevent work-related pain and injury, along with Sam. The 3 tools that I focused on were the long arm trigger point massager, which had a good handle but no sensory feedback. And she rated that a 2 out of 5. I also looked at the full hand trigger point compressor, which she thought was good for trigger points, but not for diffused areas. Does decrease stress on the hand. She rated it a 3 out of 5. And her favorite tool that we provided her with was the 3-point triangular deep tissue massager. She said it was versatile, multifunction, good for myofascial and trigger point release, easy to flip while treating to use the 3 different points, but it wasn't good for the dorsal hand or fingers, but better for the palm and wrist and forearm. She rated it a 5 out of 5 and the best tool she had.
The necessity for intervention. Workplace injuries can occur in any and all kinds of settings, and healthcare is no exception. Manual therapists such as OTs, OTAs, PTs, PTAs, CHTs, and chiropractors tend to succumb to work-related musculoskeletal disorders, which affect the soft tissues of the body. While research in this area is minimal and new, it has created constructed a concrete foundational understanding about the cause and effect of work-related pain and injury in therapists who use manual techniques and the impact it has on their quality of life. Future research is still needed to explore the cause and effect of work-related injuries and personal pain in outpatient manual therapists at a larger scale. However, this research that we have presented with you today offers a small glimpse in how occupational therapy can play a role in preventing work-related pain and injuries from occurring in this profession. The researchers would like to thank those of you who attended our poster presentation, and we will now open up for questions.